Now, quickly look at the aspect of you working on a child that's a newborn baby. Okay, a neonate is a newborn baby. So, of course, a newborn baby, you can't instruct them. So, almost everything, you are actually doing it for them by yourself. You understand? Literally. So, let's quickly look at precautions you take in trying to make sure that the imaging is good. So working with neonates and newborns in the laboratory lab, it requires a lot of care. Care though, and precautions, because they are highly vulnerable to radiation, energy. They could pick up infections, they could be stressed. So one of the key things you are doing is you are trying to actually reduce the amount of radiation energy, just to suit the child. So radiation protection, you are applying the as low as reasonable achievable. So you are trying to restrict the rays just to the part where you want to get an image. That's called limation. So you always use gonadal shading, and you protect their genitals, right? Reproductive organs, minimize repetitive exposure. So you have to actually give a very good reason to why you are doing an imaging for a child before you do the imaging. Do you understand? So infection control, you have to wash your hand before touching the child. Use a glove that has not been used before. Disinfect any instrument that will actually be used on the child and all of that. So patient handling and comfort is gently. Handle them gently. Maintain a warm environment because neonates, they lose heat quickly. Use soft positioning aids. Then avoid unnecessary movement. Okay? So neonate. So positioning and immobilization is use non-traumatic immobilization techniques. Never force the neonate into an uncomfortable position. Ensure proper alignment to avoid repeated water exposures. Monitor the neonate continuously during the procedure. So technical consideration is select low exposure factors because the neonate has a small body size. Use high-speed imaging receptors to reduce exposure time. Then ensure that the source to image distance is far enough and the rays are channeled to just where you actually need, to have an image of. So always check if they have any medical devices. Coordinate with the neonatal care units to avoid disrupting any medical support. Then keep observing the child to see if there's any unusual, signs and symptoms.